I got this question, and so I want to answer it. If you have hypertension, should you lift weights? The answer is it depends where your blood pressure is at, right? So just because you have hypertension doesn't mean that you shouldn't go lift weights. It is true when we go lift weights, your blood pressure could go up. It depends where your baseline at. So if your blood pressure is 160, I would say is probably my cutoff for people. If it's 160 or higher, I recommend not lifting weights at that point, because you're already pretty high, and then lifting weights like doing squats or something can actually push that blood pressure so high that there would be a little bit of a risk of rupturing something like an artery in your brain, or arteries in your eyeball, or an artery in your heart. So stroke, going blind, heart attack, right? We don't want that. So if your blood pressure is 180, 200, definitely don't be lifting weights. Please don't lift weights, and consider going to urgent care if you're symptomatic and getting help with it. Now, if you have blood pressure, if you have the diagnosis of hypertension, just check your blood pressure if you're concerned. And if you're like 140s and below, you can go lift. So you can go lift, you're safe to lift at that point, right? If your blood pressure is too low, you're like, well, I have the diagnosis of hypertension and my blood pressure is too low. What's too low? Well, if your blood pressure is too low, you got to look at why. Let's say you got to put on a GLP-1 receptor agonist, so you're on like Wegovy and you've been dropping weight. Well, it's time for you to start reducing those blood pressure meds. Please see your doctor so you get on some sort of reduction plan of the antihypertensive. But you can go lift. That's okay. Just be careful about doing a lot of cardio and so forth, because you can get a little dizzy, right? And then hit your head, fall down, and you get a little TBI, and now you got a concussion. Well, then that'll stop you from working out. So keep that in mind. Great question. Who sent it to me? I hope this reply helps. I'll see you at the next video.